various forms of addiction and different things, as well as ways to get help. So what is addiction? So addiction can have many definitions. It's the lack of control or inability to stay away from a substance or a behavior. There is a formal term in medicine we use as use disorder. So what use disorder is that's where the substance results in social and occupational stressors. And it can also result in having difficulty quitting that substance, interfering with your social life and personal life, having a tolerance to the substance, or having withdrawals, and having changes in your behavior and mood because of the substance. Some of the other things can also be losing your time because of the substance or behavior. So it's kind of, taking over a lot of your life outside of just the actual substance use. So taking over your family life, your friends, and your free time. So how come some of us can become addicted and others can't? There's actually many different reasons why. One of them can be genetics. For example, if you have a genetic background, somebody higher upstream in the family, whether it be a grandparent, great-grandparent, uncles, aunts, if they have a family history of drug or substance abuse problems, you can be more at risk. And that's something you could monitor for. Other things that can happen is environmental factors. So this can be depending on where you were raised, in the social circumstances you have, whether you have friends or a peer group that uses, especially in that high school, college aged group. Other things can be peer pressure and inner fears, as well as insecurities that can influence substance use or substance abuse. Some of the other factors can include the age of first use. So the younger you are when you first use, that can also play a part. It's very rare we see somebody in like the 50s and 60s, pick something up for the first time, although it does happen. Usually we really want to watch for the teenage years and that young adult, 18 to 30 age range for a lot of the substance use. And then, or behavioral dependencies or behavioral addictions. And then other conditions. So there are some conditions, if you have, it can put you at a risk of having substance use disorders or behavioral dependencies. So for example, things like attention deficit hyperactivity disorder, bipolar disorder, or personality disorders. Sometimes those can also affect your risk at developing substance use disorder. So you would want to get treatment for your other conditions to help reduce the risk of developing a substance use disorder. So is there a problem? This is a good question. Let's say, you're happening to use a few drinks or, have a cigar every now and then and wondering, is it a problem? Has it become a problem? So usually if the substance or the behavior is starting to decrease your socialization, that can be a problem. That's like you isolating or preferring to use the substance over hanging out with your friends or your family or your social obligations. Ignoring risk. So this is something you see it more with sometimes like needle use or cigarettes, being aware that there might be a risk of using the substance, but you're still using despite being aware that there's a medical or a social or psychological risk with using the substance. Also your money or your finances. Once that starts to go, that might be some symptoms that it's becoming a problem. The other things can be dependency. So this is where you kind of feel you need the substance or the behavior in order to feel normal. So if you feel like you can't go without it, that's a good time to look at it and maybe talk to a trained professional. And then withdrawals. So withdrawals can vary. For some people, withdrawals can be anger, can be frustration, being impatient. But for others, it can be shakes, sweats, nausea, vomiting. It really depends on the substance you're using. We try to say if something is like making you feel more relaxed, like for example, alcohol, and then you feel really anxious, restless, high heart rate, or breathing quickly, those might be symptoms of withdrawal. So if we start to go in the other direction, based on what the substance does, then that might actually be a withdrawal sign. So, and it's always a good time to talk to a trained professional if you feel any of these symptoms. So there's two basic categories of addiction. We have both chemical and behavioral addictions. So we like to, make sure we're examining for both. One of the chemical addictions we can have can be any substance, whether it be alcohol, nicotine, marijuana, cannabis, just various pain medication. There's various chemicals that once we introduce it in the body, it can kind of change your neurotransmitters and it can become more habit forming. This is especially true in that 13 to 30 age range. So younger adults, adolescents, we really want to keep an eye on what they're doing and what they're using. Then behavioral addictions are where a lot of times it causes that same high feeling, but without a substance being used. So a classic example is gambling. A lot of times people who have gambling disorder kind of need it to survive, or they might spend all their finances, the rent money, the mortgage money, everything is just kind of going towards the gambling because they kind of need it to feel normal and they get that rush from the behavior. Other behaviors can be like shopping. There's a newer one called internet gaming disorder that DSM-5, our textbooks have talked about, especially in adolescents. Probably down the road, we'll start to see like social media or other, habits kind of form. So just something you would want to keep an eye on, especially if it's really interfering with your family or your friends or your social life. So we'll start off talking about chemical addictions. Chemical addictions are defined as strong desire or need to continue using the substance, and even increasing the dose and having a physiologic or a psychological dependence on that drug or that substance, and feeling like you need it in order to survive. So one of our most classic ones is alcohol, but also prescription medications, especially those that are controlled, pain medications, anxiolytics, benzodiazepines, as well as some of the sleeping aids like Ambien. You can definitely become habit forming and you can become dependent on those. Other things are recreational drugs. This is cannabis, cocaine, shrooms, methamphetamine, and then tobacco. And there's like different phases. One of them is the experimentation phase. You may see this more in younger ages, adolescents with peers. And if it starts to cross over into those symptoms where it's dependence, you have a dependence on it, you need it to function, you're isolating, your money and your resources are going towards it, then it might be more towards an addiction or a use disorder. So just something to be mindful of. Now, the top 6 abused substances, this is coming from, there's a lot of data out there. I know the National Institutes of Drug Abuse, NIDA is one of them, but alcohol is actually one of the top most widely abused substances. And it can be kind of tricky because it is a legal substance, it's readily available, you see it almost everywhere, and it's heavily advertised as well as socially acceptable. And then this can actually be the #1 gateway use for gateway drug for teenagers. So something to be mindful is just if you have younger children at home, I know you would secure guns and you would secure the car keys, maybe bottles of vodka or liquor cabinet. Those are things that definitely need to be mindful of, especially around teenagers. I feel like there's just a lot of temptation, teenagers get into things as well as children. Some of the other things can be opioids. So opioids involve both prescription and illicit versions of the opioids. So prescriptions can include Oxycontin or oxycodone, hydrocodone, morphine, methadone, and fentanyl. And then some of the illicit forms can be heroin and fentanyl. And so it is legally prescribed a lot of times by doctors, but it's also available on the street or sold amongst a lot of different social circles. A lot of heroin users, about 80%, begin by using prescription opioids and end up becoming dependent. And then overdose deaths have increased dramatically due to heroin and other illegal drugs being readily available and laced with fentanyl. So that's actually one of the current things. They've had several bulletins and news alerts from the CDC that even if you're trying to buy like an Adderall or you're trying to buy cocaine, people are putting fentanyl in it. So you don't really know what you're getting if you're buying it from the street pharmacy or from a non-reputable source. And a lot of times people are having accidental fentanyl overdoses. So something to be mindful of. And then stimulants, that's another widely abused substance. So stimulants is another one like amphetamines or methylphenidate, methamphetamines. There's some legal forms, which are Adderall or Ritalin formulations, but then there's also some illicit forms, which can be like your cocaine, your methamphetamine, and speed. So a lot of times we would just want to make sure if someone does have attention deficit hyperactivity disorder, their medication is being taken as directed and it's not being overused, or given to the friends, or given to the family members, or being sold. So that's something just to be mindful of. And if we treat attention deficit hyperactivity disorder, you could be less likely to abuse some of the other substances. So it is important to take care of your mental health. Some of the other substances can include sedatives, hypnotics. So these are things like benzodiazepines, or we call them the Z class of medications, Zolpidem, or Ambien, Lunesta, Sonata. Benzodiazepines can include things like Xanax, clonazepam, lorazepam. A lot of times they're legally prescribed by providers for anxiety or insomnia, but it just depends on how long you're taking them, as well as if you're using them as directed. Sometimes these as well have abuse potential, or can be shared amongst family or friends. So something you just really want to be mindful of if you're taking any sort of sedative or hypnotic medication. And then sometimes it is misused in conjunction with other substances to kind of give you more of a high or more of a euphoria. I know right now in the music scene, Xannies or Xanax, there are a lot of times that used. Unfortunately, there has been a lot of younger music artists who have accidentally overdosed or had an overdose death because of combining alprazolam with opioids with alcohol. So there is abuse potential from this class of medicines as well. Then marijuana is kind of one of our newer substances. It's been around for a while, but it's kind of tricky in the fact that in several states, I don't know the exact count off the top of my head, I think it's about 20 or 25, it is legal. So with cannabis, the chances of adult addiction do increase depending on when you first started using it. So especially if you have really early use, that 13 to 17. Dependence does appear to be linked to how an individual's brain reacts to that cannabis. And then it's readily available, as I talked about a little earlier. So it just really depends on the state. Just like with alcohol or with nicotine, if it's starting to take over your personal life, your family life, your finances, then it might be time to talk to someone. And last but not least, I put nicotine on here. If you actually look up a lot of abuse substances, nicotine does not pop up as one of the top 10, but a lot of people do use nicotine, and it does have a lot of consequences with COPD and health conditions that you see 20, 30 years down the road. So I just wanted to give a shout out to nicotine. Definitely if you're using, make sure you talk about it with your trained healthcare provider, because there's a lot of ways to help you quit using nicotine or replace it with counseling and with medications. So what are some of the consequences of having an addiction or a behavioral addiction? So it can affect your relationships. A lot of times you're dealing with your spouse, your relatives, colleagues, friends, and neighbors. Those relationships can be damaged because the further along you go in the substance abuse, you may have heard like people burn their bridges, or a lot of times they get isolated, and it's really unfortunate because the substance is kind of taking over, and that's when they would need more of these sober supports or sober friendships. But with people with substance use disorders, kind of like that, some of the behaviors can come like the anger, the frustration, taking money, taking the medication. So it's one of those things that definitely should be done with a trained professional. Employment can also be affected. So it's really hard to hold a job and keep a job if a substance is kind of bleeding over into your work performance. This can include things like your focus on your job and your career can wane. And then especially as a substance use increases. And then you can end up actually having a termination from your position, which can then cause financial issues. So it is a lot better to intervene earlier in the process than later. So whether if it's through human resources or talking to your primary care provider, there may be ways to get help before it leads to job loss. There's also some legal stressors that happen with substance and behavioral addictions. So what legal stressors can be is, unfortunately, a lot of times abusers are involved in legal situations such as DUIs, DWIs, domestic violence. debt and bankruptcy. About 80% of those who commit crimes and 50% of inmates in the US are clinically addicted. So one of the things that we've learned is just the United States prison system is actually the biggest treater of psychiatric conditions. So I know it's kind of unfortunate, we're trying to treat everyone in an outpatient setting, but fortunately, a lot of people with substance use disorders do end up in the legal system. And then health. Health is another thing that can be a consequence from substance use disorders or behavioral addictions. This can be like, your health can go down, you can have hypertension. For heavy drinkers, you can have neurological problems. People with IV drug use can have risk for HIV or hepatitis C. So there's just other medical conditions that can happen as well. Nicotine with lungs, COPD. So there's a lot of body systems that can be involved with long-term substance use. So now we're going to shift gears a little bit and talk about treatment and recovery. Treatment and recovery programs are determined and based on your age, your overall health, and the extent of the symptoms that you have, as well as your motivation to get treatment and this type of substance use. So for example, for a lot of people who have more lighter substance use, they may be able to be treated in an outpatient setting, even with just a psychiatrist or a therapist. But then when it's more moderate to severe, that's when you might need to consult with a facility or trained professionals specifically in substance use disorders or behavioral addictions. Detoxification may be necessary depending on the substance used. So the main ones, alcohol can have a really bad withdrawal, which is a medical emergency. So alcohol might need a detoxification based on your severity. Another one could be benzodiazepines, those Xanax, clonazepam, sometimes that requires detoxification. Occasionally marijuana. Sometimes people can use so much marijuana, they can have a syndrome called hyperemesis. So this is where when you quit marijuana cold turkey, about 24 hours, you can have just nausea and vomiting nonstop. So warm showers, hot showers actually helps for that, but it might, you might need to go to detoxification as well to help get off of the cannabis. And then long-term management. So when you do have long-term management of a substance use disorder, behavioral addiction, you may need medical supervision and formal group meetings with psychosocial supports. So this is where 12-step programs, Alcoholics Anonymous, Gamblers Anonymous, Shoppers Anonymous. I think they have an anonymous for almost everything, Nicotine Anonymous, Cocaine Anonymous. So pretty soon we'll probably see a Gamers Anonymous as well for people who are on internet gaming disorder, but just having that support, because it's a lot better to talk to someone who's been through it sometimes than talk to your parents or talk to someone from a higher position of authority. Sometimes it's better to have peer support. And then psychotherapy. Psychotherapy is individual and family counseling. And so this is recommended because a lot of times with the addiction or behavioral addiction, there's an underlying disorder, whether it be anxiety or a mood disorder or attention deficit hyperactivity disorder. So getting the treatment for the anxiety or the depression will be very important and will help with the sobriety as well. Behavioral addictions, we talked a little bit about this. So these are also called process addictions, and they can follow the same pattern as a substance use disorder, where it kind of causes a lot of problems in your social, your occupational, your personal life, your financial life, and your free time. Some of the more common ones, binge eating or food deprivation. These are maybe people, who extremely eat in a short period of time and feel very guilty about how much you eat and you don't have control. Food deprivation. Sometimes, a primary care provider would be a good person to start with, or a mental health professional, just to assess about your eating habits. Exercise. So exercise is a good thing, but sometimes too much of a good thing, can be bad. So this is where if you're exercising nonstop, people who are like tearing tendons, breaking bones, can't stop their exercise just because they kind of have that drive and spending large hours a day where it's interfering with their personal life, their social life, and maybe even work. Gambling and shopping. So gambling is a gambling disorder. Luckily in Texas, I don't believe it's legal just yet, but they have lottery, but some of the other states where it is legal, sometimes you just have to keep an eye out for this. I know there's a slot machine, but I can't really go to Vegas anymore because I guess the psychiatrist might. But I like to look around and, you see the people just there like in the morning and at night, just 12 hours or 10 hours at the slot machine. And so usually if it's starting to interfere with your personal life or your social life, it might be time to talk to someone. And then shopping, we have a thing called, retail therapy, but usually if it's starting to affect the finances, then it might be getting a little too much. Plastic surgery and cosmetic dermatology. So this is more like a body dysmorphic disorder. Sometimes people may have that drive where they just have to keep having procedures done. And usually plastic surgeons should be evaluating for this, but they can refer out to like a therapist just to get clearance. And then tattoos for some. Sex and pornography, that's another one. It's not a formal disorder, but in America, in terms of the DSM manual we use, but in Europe, they do have a compulsive sexual behavior disorder. So in Europe, they have classified that sometimes sex and pornography can become a habit and can really take over your life. And then social media, internet, and video games. This is kind of on the horizon. A lot of psychiatrists are keeping an eye on this because, especially I think that school age or high school aged teenagers, sometimes they can just really spend days and days, doing their video games on the weekends. And so they might be neglecting other duties like their schoolwork or their social life, or even their own personal health and hygiene. So something to keep an eye on. And then last but not least, so the thrill-seeking activities and dangers. This can actually be like a temperament trait or personality trait where if someone is extremely thrill-seeking, they need just to be careful because sometimes substances can come in as a way to continue that thrill, especially the like stimulants, cocaine or methamphetamine. So just something to be mindful of. Someone is like an extreme sport enthusiast or really focused on having that like adrenaline rush. And then even healthy behaviors can become compulsive. So that was kind of like exercise, it can be good, but then it can kind of take over, or shopping can be good, but then it can take over. So just to be mindful of that. So signs and symptoms of a behavioral addiction. So this is where you're starting to fight with your family and friends. You might be neglecting your self-care, starts to affect your sleep. You might just stay up all night doing that behavioral addiction, start to miss school, work, or other significant social events, lying to your family and friends about the behavior in order to keep doing the behavior, kind of making an excuse so you can duck out and do it. And then feeling denial, guilt, or shame at the fact that you've done the behavioral habit or the behavioral addiction. So a path forward, we're going to talk a little bit about kind of how we can get help for some of the behavioral addictions. So behavioral addictions, they are relatively new, or like there's newer light being shined on them. And so actually some can increase with the rise in technology, and they're relatively new to the mental health lexicon. So a good example is internet gaming disorder. We started recognizing that in 2013. But before 2013, there would be no talk about internet gaming disorder. So on the horizon, technology, can make it not only easier to have behaviors, social media, internet gaming, maybe shopping, but also people use technology to get other substances as well. It's a lot of like delivery and online pharmacies and things. So something to be mindful of. For the diagnosis, so while there's no standardized method for diagnosing several of these disorders, mental health professionals, they are being more cognizant. So we're using a lot of the criteria for like, let's say a gambling disorder or internet gaming disorder to classify if something else is becoming a disorder. And then a lot of the treatments will still be the same to help with that compulsions. So even if it's a gambling or if it's pornography or if it's shopping, a therapist or a psychiatrist will use similar treatment to help you with that compulsion or that internal angst you might feel. Some of the treatments, so this is individual counseling, cognitive behavioral therapy, talk therapy, and group therapy are known to be effective in helping treat behavioral addictions. Substance abuse is often combined with behavioral addiction. So unfortunately with COVID-19, I know it's been kind of a rough, couple of years, and there's been a lot of isolation. So with the isolation, some of these behaviors have been easier to hide because you're just not going to school, or you're not being in large crowds anymore, or people aren't like checking in on each other as much, or maybe working from home instead of working in a building. So something that, to be mindful of. And and to see like if you've noticed any of these changes. And then consequences. So behavioral addictions, even though behavioral addictions may not suffer the same risk to your physical health as with chemical addictions, you can still have a lot of suffering in terms of for you and your loved ones. So it can still affect your social life, your personal life, your financial health. So behavioral addictions, even though they're a little bit different, they still can have a lot of consequences. So it's a good idea to talk to a trained professional if we need to. And so some of the treatment options, treatment is different. No two treatments are the same. We try to meet the person where they are. And so through intense and comprehensive therapies, behaviors can sometimes be modified and helping those that who have these behavioral addictions kind of reclaim their lives. So there's an individualized approach. This is where each behavioral addiction is unique and we try to make it tailored individually to that specific person. Counseling is very important because a lot of times with behavioral addictions, there might be something underlying that's driving it, whether it be anxiety, depression, trauma. So it's important to do that individual counseling to kind of address if there's anything else happening at the same time. Determining a root cause. So with a root cause, this helps to manage our emotions and establish impulse control and coping mechanisms that work. For example, for some of our members, we've talked about like a family member managing the finances or a loved one kind of keeping an eye on the finances so they can see where the money is going or if the money is going out for gambling. Gambling is probably the one we encounter the most, but having somebody as part of your team might be helpful as well. And then medication. So there are medications out there that will help to treat some of like the angst or the anxiety you feel when you don't do the behavioral addiction. These are things like antidepressants. And there's also some other medications which we use for other chemical addictions, which we use for behavioral addictions as well. So one of them is naltrexone, which helps with cravings, but we use sometimes some of our other meds to try helping with the cravings for the behavioral addiction. So I'll go over some treatment options. There are various levels of treatment options, and the levels of care can really depend on the severity of your addiction, your insurance coverage, and your level of motivation. So there's 4 real big levels. One of them is inpatient detoxification. This is usually our highest acuity. This is like if someone is having withdrawal from alcohol, benzodiazepines like Xanax, or polysubstance use, someone's on heroin, cocaine, or heroin and alcohol, or 3 or more substances, then an inpatient detox might really be the safest place for them, just so that way there's a medical doctor and nurse observing them and making sure they can give them medications and treatment. Inpatient rehab, these are usually 30 days. It just kind of depends on the insurance. There is a lot of talks of going to an outpatient model, which is where people can do the rehab during the day from 8 to 5, go home at night, go back every day. Sometimes that outpatient model is preferred by people who may have children or young kids, just because it's really hard to say to go away from your obligations for 30 days and like not see your family or not see your friends. But it just really depends on the severity of the condition. Sometimes you might need that 30 days to really get the treatment. And they have counseling and a lot of group activities as well as individual counseling. So it's supposed to treat the whole person. Now, residential treatment. So residential treatment is for those who may have more moderate to severe substance use disorders or behavioral addictions. This can be 60 or 90-day programs, sometimes 6 to 12 months. We see this more with adolescents. There's some really good programs in the area. Veterans, they may have that ability to access residential treatment. A lot of it depends on the insurance, but there's usually, they have that 6 months, 12 months. Liv Menninger is another one that offers some sort of residential treatment. And then outpatient treatment. Outpatient is the lowest acuity. So this is more for our mild to moderate cases where, you're still able to come see a provider once a month, once every 2 weeks, and work on your substance use or behavioral addiction with the outpatient provider. So we do have some FDA approved medications. I just wanted to briefly touch on because there is hope out there, and doctors have a lot of access to these medications to help with substance use disorders. So with alcohol use disorder, there's 3 that are FDA approved. Naltrexone is one. I believe Revia is its brand name. disulfiram or antabuse, and acamprosate or Camprol. So naltrexone is a pretty good one. Nausea can be its main side effect. Disulfiram or antabuse, that's the one that most people know, where if you drink with it, you can have a flushing reaction. It kind of gives you an instant hangover. So for people that are really highly motivated, it's good. But for someone who might still be using, they can have like nausea, vomiting, diarrhea. You go instantly into a hangover and feel like really sick to their stomach. So for some it works, but for some they don't want that reaction in case they're tempted or they use. And then acamprosate is a pretty good medicine. It's a little bit better at maintaining sobriety, but it has to be taken 3 times a day. So sometimes people prefer the naltrexone because it's once a day instead of 3 times a day. Then nicotine use disorder, there's various treatments, nicotine replacement therapy or treatment, whether it be gum, patches, lozenges. This is a good one. I know vaping is on the rise right now, and it kind of is like hidden because you can vape like, in school bus, or you can vape in the bathroom. It doesn't have the same smell that cigarettes used to have that you can catch somebody, but I would definitely have a conversation about those 13 to 30-year-olds about vaping. And then besides the nicotine replacement treatment, varenicline or Chantix or bupropion, those are some of the other medicines that can help someone get off of nicotine. Then opioid use disorder. So opioid use disorder, which has been kind of really coming to more of a light over these last 8 years. Naltrexone is one of our options. It's both FDA approved for opioids and alcohol, but it blocks the receptor when you do take opioids, so it doesn't give you the same rewarding effect. Bupropion, buprenorphine, and methadone are actually opioid agonists. So they are opioids, but these are used more for people who have severe withdrawals and who need maintenance treatment. So buprenorphine, a trained provider can give you in an outpatient setting. Methadone, you do have to go to special clinics because there's a lot of federal regulation. So methadone is through a clinic. And then naloxone, it's not necessarily a treatment for opioid use disorder, but I would recommend everyone have one if you have somebody in the family who has substance use disorders, because it's the antidote in case there's an overdose. So police officers, I believe ambulance, hospitals, they all have access to this. It comes in a nose spray and an injection. And it's something that can be given in the field, and it kind of revives you. So especially if there's anybody who may have trouble with pain medications or substance use disorders, and I believe you can get it at the pharmacy without a prescription. So naloxone is a life-saving medication that you can just get from any pharmacy. So treatment options, what to do if you're concerned about yourself or a loved one. Main thing is probably don't go it alone, definitely reach out. There's several ways we can reach out. A medical professional, whether it be a primary care provider or therapist, is a great place to start, because if they don't know how to help, they should be able to look into somewhere where they can help. And plus, it's better to have 2 minds on the same problem rather than just one. So definitely reach out to your primary care providers or a therapist. If you have certain insurance programs, have a behavioral health plan on the back of the card. If you call the behavioral health plan, I know for a lot of people here, it kind of varies based on your insurance coverage, but they can be very helpful with not only finding therapists, psychiatrists, or psychologists, but they can also find facilities based on your zip code. So you can reach out to the back of your insurance card as well for the behavioral health plan. The City of Houston, they have a really good program here called the Houston Council on Recovery. They're a nonprofit located near Memorial on Jackson Hill Street. I've toured their facilities. They've been very excellent and friendly. They can take anyone and look at their insurance, even if there's no insurance, and find treatment for them. So they can find outpatient care, rehab, groups, AA, whichever type of therapy you want, they'll work with you, and they'll look at your insurance and kind of help to manage that. So they're a really good resource, and no referral is needed. They do walk-ins. I would just call them before you do a walk-in because of COVID. Sometimes they have like a quota, or they have a specific time for you to come. So they're a nonprofit, and there's no charge to use their services. So definitely you can reach out to them, and then they can use your insurance to find the best treatment for you. And then some of the facilities they contract with for either detoxification or rehabilitation can include New Dimensions, the Park, Menninger, the Right Step, Senecor, and Cheyenne Center. So this is just the example. They have 50 to 100 more that they know about, but the Houston Council is definitely one of the better resources here in Houston. So I'd highly recommend them. And then I appreciate your time today, and we'll have some time for questions.
So if you guys have any questions, feel free to type them out in the text box in the comments, and I will read them out for Dr. Patel. I have some questions. So my first question is, can addiction lead to mental health disorders or vice versa?
Yeah, it's a good question. So addiction can lead to mental health disorders. We have a term for that actually, like let's say, for example, alcohol. You use alcohol enough, it's a depressant, so it kind of brings you down, makes you tired, makes you relax. But what alcohol can do is it can lead to an alcohol-induced depressive disorder. So for a lot of people, if they're using a substance and they start to have depression or anxiety, we like to help them get treatment and stop the substance, and also treat the depression or anxiety. For a lot of people, their symptoms get better. So if the symptoms get better within 2 months, then the mood disorder or the anxiety disorder can be due to the addiction. Let's say the mood or anxiety is still there, then it might be a separate condition. But once again, anxiety disorders, depressive disorders, they can sometimes lead to self-medication, which is the addiction.
And you briefly mentioned like vaping, and I know vaping is a very common thing in like even middle schools, high schools. Like, I guess, let's say a child is going through this, what can parents look out for symptoms or sign that their kid might be vaping?
That's a good question. So how to tell, if maybe the child or teenager has gotten into something, it could be vaping, nicotine, or even vaping, cannabis, just really mood changes, behavioral changes. If you're noticing any of those, like isolation, grades start suffering, not doing the activities they used to do, giving up their hobbies, or even their money missing, money allowance or their paycheck is going a certain way. That could be a sign as well. And then having that conversation with them. And if they're not willing to have it with you, then with a pediatrician or a therapist, having them speak with them, and then they might be more willing to disclose in a family session, like with a professional there.
I have a question. You talked about some of the risk factors for addictive behaviors and adopting things like alcohol, drugs, whatever. And what if someone has multi-generational factors involved? So they have a great grandparent or multiple great grandparents, multiple grandparents, multiple parents. And then they also have things like bipolar and ADHD. Are they more apt to adopt addictive behaviors or addictive, take on things like alcohol and drugs and things like that? Would you be concerned?
Yeah, so definitely with the genetics, there's actually really good studies that they've done in the 50s and 60s, twin studies, where they looked at twins who were adopted, and they found that twins 40 to 60% of the time, even if they were separate, they could develop the same use disorder. And it depends on the substance. Some are more habit forming or more addictive than others. And then of course, if you have bipolar disorder or ADHD that's not treated, then that could also be a risk factor. So probably for someone who may have a strong family history, I would try to get in early with a primary care provider or therapist or psychiatrist, just to have a baseline and for them to kind of work with you just to keep an eye or to monitor on any of the risk factors. They can also help you if there is bipolar disorder or attention deficit hyperactivity disorder. They would be able to treat the other condition to help reduce your risk of developing a substance use disorder. No problem.
We do have a question from the chat, and it is, are you familiar with the St. Clair method using naltrexone?
The St. Clair method?
Yes.
Using,
Naltrexone?
I'm not familiar with the St. Clair method. I'll have to look into it and then maybe write out an email response and email it to Dan.
Okay, because she said a former teacher colleague of hers cured her alcoholism, her alcohol addiction.
With the St. Clair
With
method?
the St. Clair method.
Sinclair method, Sinclair.
Oh, St. Clair.
Yeah, she says, are you familiar with the Sinclair method using that naltrexone? a former teacher colleague of hers says it cured her alcoholism.
Yeah, so I'm familiar with naltrexone. Naltrexone is the medication on the approved treatment list that we talked about, where naltrexone will help with the cravings and naltrexone will help block the reinforcing effects of alcohol. The Sinclair part I'm not too familiar with, but I'm familiar with the naltrexone, and each person is different. Some, use exercise, some use meditation, acupuncture. I've heard of some using acupuncture to help give up cigarettes. So each person is different. It just really depends on what works for you, as long as it's not replacing one thing with another thing.
I have a question. So I have a lot of clients that have co-occurring disorders. And I try to do a lot of care coordination with their doctors. And I want them to be upfront and honest with their doctors and let them know of the substance use that they do. But they're afraid to tell their doctors because of the stigma and the shame. They think that the doctors is gonna blame whatever illness they got on their drug use. So how can they have that healthy conversation with their PCP provider about their substance?
About their substance use. So no, that's a good question. And their attitudes even in medicine are changing. Like the way medicine used to see substance use disorders 40 years ago or 30 years ago is completely different today. They may be able to practice role play, maybe with a therapist, where you can have that conversation with your therapist about, how to break the news. Or you could always explore the Houston Council, and they can set you up with a therapist or a licensed chemical dependency counselor, just to even keep an eye on it. If you don't feel comfortable with your primary care provider, then the Houston Council can set you up with a counselor as well.
Okay, thank you.
Yeah, no problem.
I have a question about fentanyl. Because you hear more and more, and it was in one of the slides earlier, you hear more and more about street drugs being laced with fentanyl. And obviously it will kill you because it's killing a lot of people. So why would a dealer lace drugs with fentanyl if they know it's going to kill their customer? I know that sounds like a crazy question, but it just, like, none of that makes any sense to me. Like, why would you, like, what is the benefit of it to anybody, to the user? What is the benefit of it to the user?
Right, what would the benefit be of the fentanyl to the user? So fentanyl is one of the most potent opioids that we have. So a lot of dealers will cut heroin or other substances with it just to kind of give them more of that euphoria or that extra high.
Okay.
But even if they lose a customer, sometimes the demand for it is so high that people will actually flock to where the regions are, where people
Okay.
are overdosing on fentanyl, because they'll know, oh, this is a really good batch or a really good dealer. And so, and no two people are the same. For one person who takes fentanyl, they might have a different reaction compared to the other. But since it's illicit, you don't really know what you're getting.
Yeah.
And plus, people are now starting to put it in other pills. Like if you get a counterfeit oxycodone or you get a counterfeit Adderall, you don't know where it came from or how reliable that dealer is.
Wow.
Yeah, so it's best to
So
get
some,
things.
so some of the deaths that have happened from it, the user actually knew or sought out something that was laced with fentanyl because of the added whatever.
The added euphoria, the added
Yeah.
high, the potency, that it's so much stronger. But there are a large number of cases where people were thinking they were
Didn't
taking
know.
one thing,
Mhm.
and then they unfortunately took it.
Yeah.
And a lot of musical artists recently,
Right.
it's been in the news where they've taken what they thought was a hydrocodone, but it has
Yes.
fentanyl in it, and so then that ended up taking their life.
Yep, time for one more question. I'll go. So the legal use of marijuana is spreading in the US. Do you think that this will lead to an increased number of marijuana addictions?
Well, so marijuana is one of those things that kind of it's mixed since it's so new, and people are there's been traditionally one view that medicine has had towards marijuana, and then there's a lot of purposes that they're using it for now, like epilepsy and chronic pain. About 91% of cannabis users will be perfectly fine when they use it. They can use it, have fun, put it down. 9% will probably have risk of developing a dependence. So if you're in that 9%, then we would say, you definitely should be careful, watch out, as well as there is an increased risk of psychosis if you have a family history of psychosis. So if there's any like schizophrenia or schizoaffective disorder, then, we would try to be careful because they're making it so much more potent now compared to the cannabis from the 70s and the 60s. So the more potent strains may cause more of the side effects or more of the reactions. So it's kind of mixed, but definitely talk about it with someone if you're going to use, whether it be a trained professional or a counselor.
Do you think that the 9% do you think that they are self-medicating?
I mean, they could be the 9% who do develop a dependence or a cannabis use disorder. They might be medicating something else like an anxiety, a trauma disorder, or depression, or they might have the genetics for it. Like if they had a relative who had alcohol use disorder, they had a relative who had opioid dependence. So just something that they would have to individually monitor for. All right, and thank you for your time today.
Thank
so
you.
much.
Thank you, Dr. Patel. That was a very informative presentation. We appreciate you taking time from your practice and your busy day and to share your expertise on this topic. I know I learned a lot. I'd also like to thank Kelsey Siebel Clinic for being our partner in this awareness series. Stay tuned because we have something coming up each month where we'll partner with Kelsey Siebel. Next month is all about mental health. May is Mental Health Awareness Month. We're so excited to be back here again. I cannot remember the date, but if you go to our website at www.thewomensfund.org, you can look under free seminars and free events, and you can see that date will pop up in May. It's May 18th. Okay, thank you very much. If you like today's program, like us on Facebook, follow our other social media accounts, and visit our website. As I said, it's thewomensfund.org, and stay current on our events like this one. A recording of today's session will be posted on our YouTube channel. There'll be a link on our website. It takes us about a week to get it up there. So give us a little bit of time. So if you missed something that you want to go back and look at, you can see this whole presentation again next week. And you can also share it with others. That concludes today's presentation. And one last little plug, I want to thank Chick-fil-A for those who are here with us today, who donated today's lunches. So thank you again. Enjoy the rest of your day and come back and see us next month on the 18th.
Thank you so much.